Emily Oster, Expecting Better, Why the Conventional Pregnancy Wisdom is Wrong, and What You Really Need to Know. Are you overwhelmed by the deluge of conventional pregnancy wisdom that surrounds you? Dive into Expecting Better by Emily Oster to unravel fact from fiction in maternal healthcare. This book takes a meticulous approach by utilizing the author's economic decision-making principles to sift through the muddled world of prenatal care. Oster's findings illuminate the distinction between good data and the flawed information that many pregnancy guides are based on. Learn how to understand the costs and benefits of pregnancy-based decisions to make informed choices, rather than blindly relying on confusing and often contradictory advice.
Decoding pregnancy do's and don'ts. Overwhelmed by the sometimes contradictory do's and don'ts of pregnancy, economist Emily Oster decided to apply her decision-making principles to her prenatal medical journey. By sifting through academic literature for reliable data and evaluating the personal costs and benefits of each decision, Oster discovered a way for expectant mothers to make informed choices instead of blindly following recommendations. Her findings often challenge or support conventional wisdom, but most importantly, they empower women to take control and think critically during pregnancy. Faced with a barrage of advice and often rigid, contradictory guidelines during her pregnancy, economist Emily Oster wondered how much of this information was based on reliable evidence or simply perpetuated by social norms and misinformation. Seeking answers, Oster applied her economic decision-making principles to the world of prenatal medical care. Applying an economist's approach involves two crucial factors: gathering accurate data and assessing costs versus benefits of each decision. Oster found that most pregnancy books and articles fell short when providing dependable information necessary for making informed choices. To uncover the truth, she turned to academic medical literature that formed the basis for official recommendations. Navigating through a plethora of research, Oster honed her skills in differentiating between high-quality trials and low-quality studies. Since economists often cannot rely on randomized trials, they excel at extracting insights from observational data. In Oster's case, studying pregnant women and alcohol, she was unable to ethically force subjects to drink, but she could analyze observed patterns among those who did. Through this lens, she realized that many pregnancy recommendations were not only based on flawed studies but were often excessively cautious interpretations of those findings. The second component of the economist's approach is evaluating the costs and benefits of each decision. This assessment, however, is highly personalized, especially during pregnancy. Expectant mothers have unique preferences and priorities, making a one-size-fits-all approach unfeasible. By understanding the various costs and benefits of specific choices, women are empowered to make informed decisions rather than blindly following recommendations. Oster's research covers many aspects of pregnancy and often either supports or challenges conventional wisdom. While her findings may not dictate one's decisions, they provide valuable evidence that encourages expecting mothers to take control of their pregnancy, think critically, and make knowledgeable choices tailored to their individual needs and values. Debunking pregnancy myths. While age, physical condition, and timing do play a role in pregnancy, there are many misconceptions that might worry potential parents. Understandably, age is an important factor, but fertility doesn't drop drastically till after you turn 40. Maintaining an average weight is more significant than being in perfect shape, and properly timing conception can be achieved through temperature charting or analyzing cervical mucus. Once you've done all these things correctly, there's no need to stress too much over abstaining from alcohol during the 2-week wait. "You're most fertile before 35 is a common phrase thrown around, but that's not exactly true. While fertility does decline with age, women over 40 still have considerable chances of conceiving. In a study of 2,000 women trying to get pregnant, 36% of those over 40 succeeded within a year, proving that age is not an absolute barrier. Weight can also impact pregnancy, but there's no need to fret over a few extra pounds. Although obesity can contribute to complications for both the mother and child, being in perfect shape isn't necessary. If you want to optimize your chances of getting pregnant, timing is key. Conception can occur up to 5 days before ovulation, and it's easiest to conceive during ovulation or the day prior. To determine when you're ovulating, you could use temperature charting, analyze your cervical mucus, or use ovulation prediction kits, commonly known as P-sticks. Although P-sticks are the most accurate, temperature charting is a free, simple alternative. Just remember to measure your body temperature every day at the same time. Your body temperature will rise for 2 weeks after ovulating, allowing you to detect ovulation in retrospect. On the other hand, cervical mucus can provide you with a more immediate indication of ovulation, as it becomes clear and stretchy like egg whites right before ovulation occurs. After you've carefully timed intercourse and followed all the recommendations, you might wonder if you should avoid alcohol during the 2-week wait to find out if you're pregnant. The answer: no need to stress over it. Moderate alcohol consumption during this period isn't likely to cause serious harm. However, excessive alcohol intake can damage developing cells. Drinking heavily may prevent the embryo from developing altogether, resulting in a failure to become pregnant. In the pursuit of becoming pregnant, it's crucial to separate facts from myths. Instead of worrying unnecessarily, focus on understanding and applying accurate information that can increase your chances of successful conception. Debunking pregnancy myths. Pregnancy is often accompanied by worry, particularly about miscarriages, and advice on what to avoid. However, some common concerns are unfounded. Light drinking, caffeine, and sushi are acceptable in moderation, while raw eggs and fish pose no additional risks to expecting mothers. To minimize miscarriage risks, focus instead on avoiding raw meat, washing produce, and steering clear of cat litter. Be aware that miscarriage probability gradually declines throughout pregnancy and can be influenced by a woman's age, in vitro fertilization, or previous miscarriages. Finally, experiencing nausea is actually a reassuring indication of a healthy pregnancy, and treatments range from natural remedies to safe prescription drugs for severe cases. Deciphering prenatal testing choices. Prenatal testing is a significant decision for expecting mothers, aiming to detect chromosomal abnormalities such as Down syndrome. It consists of prenatal screening and invasive testing, each with its pros and cons. Prenatal screening isn't entirely accurate but can identify irregularities through blood tests, ultrasounds, and analyzing cell-free DNA. Invasive testing provides definite results but poses a small risk of miscarriage, involving either an amniocentesis or chorionic villus sampling (CVS) procedure. Expecting parents can also choose to forego testing and trust the natural statistical likelihood based on the mother's age. Prenatal testing is a complex and emotional topic for pregnant women, and there's no one-size-fits-all answer. At its core, prenatal testing seeks to identify possible chromosomal abnormalities such as Down syndrome using 2 methods: prenatal screening and invasive testing. Prenatal screening can be thought of as a preview, offering an indication of the baby's health without absolute certainty. This method has evolved from blood tests and ultrasounds to the more accurate analysis of cell-free DNA found in the mother's blood. While this technique considerably improves the detection of irregularities, it's essential to remember that false negatives and false positives may still occur. In contrast, invasive testing provides a 100% accuracy rate for detecting chromosomal abnormalities but carries a small risk of miscarriage, about 1 in 800. There are 2 main types of invasive procedures: amniocentesis and chorionic villus sampling, CVS. Amniocentesis involves extracting a baby's cell sample from the amniotic sac between weeks 16 and 20 of pregnancy. CVS, a newer method, samples cells from the uterus between 10 and 12 weeks but is currently less popular due to the use of cell-free DNA testing. Ultimately, the decision to undergo prenatal testing or not is a deeply personal choice. Another option for parents is to forego medical intervention, consider the statistical likelihood of chromosomal abnormalities based on the mother's age, and simply wait until the baby is born. No matter the decision, understanding the pros and cons of each testing option is vital in making an informed choice. Pregnancy wisdom debunked. Pregnancy is a complex journey with unique characteristics and concerns in every stage. Doctors often focus too much on weight gain, but, in reality, gaining too little poses more significant risks to the baby. While exercise and sleep are challenging during pregnancy, there is no harm in light activities like prenatal yoga. As for sleep, Unisom is a safe option, but Ambien should be used cautiously. Not sleeping on one's back is debatable, with evidence suggesting its impracticality. In the second trimester, you can determine the baby's gender through ultrasound or invasive testing or even blood samples, but not all methods are 100% accurate, and old wives' tales hold no credibility. Navigating premature birth concerns. The third trimester of pregnancy marks the highest risk of complications, which include premature births. Although bed rest is often prescribed to counter this possibility, it lacks substantial evidence in its effectiveness and could lead to negative side effects. Thanks to recent technological advancements, babies born up to 22 weeks early have a chance of survival, with rates increasing significantly as they move toward the full term. Medical professionals can administer drugs to delay labor for a few days, providing time for a steroid treatment that speeds up fetal lung development. Meanwhile, monitoring cervical dilation and effacement can help to predict the onset of labor. It's important to be wary of scheduling labor induction or a cesarean section as a convenient choice, rather than prioritizing the baby's welfare. Non-medical inductions like nipple stimulation and membrane stripping have been proven effective in certain cases. 3 stages of labor demystified. Labor has 3 stages: dilation and active labor, pushing, and placenta delivery. Each comes with its own potential complications, misconceptions, and medical interventions. Understanding these stages helps in making informed choices and managing expectations during childbirth. Labor is not a one-size-fits-all experience and often comes with misconceptions. In reality, labor consists of 3 distinct stages, each with unique challenges and potential complications. The first stage has 2 parts, dilation and active labor. This stage may last for days or even weeks. It is commonly believed that the cervix should dilate at a rate of 1 cm per hour, but a study suggests that 1 to 2 cm per hour is the average. If dilation is too slow, doctors may give Pitocin to induce labor or perform a C-section if the baby is distressed. Contrary to popular belief, most women's water breaks after labor has already begun, and only 10% experience breaking first. If the water breaks before contractions start, labor may need to be induced within 12 hours. Active labor may also require intervention if progress is slow. In this case, a doctor may break the water if it hasn't already, and give Pitocin to expedite the process. The second stage of labor involves pushing, which can range from a few minutes to a few hours, ending with the baby's birth. Difficulties in pushing often stem from the baby's position. C-section might be an option even if a vaginal delivery was intended. 2 situations include previous C-sections with associated risks for vaginal birth after cesarean, VBAC, and breech births, where the baby is positioned feet first. In half of breech cases, doctors can manually reposition the baby. The third stage involves delivering the placenta, which can be painful but is typically quick. After labor, delaying the clamping of the umbilical cord can benefit preterm babies by supplying extra blood and reducing the risk of anemia and other complications. Understanding the stages of labor helps set realistic expectations and knowledgeable decisions during childbirth. Navigating birth choices. In preparation for childbirth, consider forming a personalized birth plan that includes decisions on pain medication, episiotomies, and the assistance of a doula. Furthermore, evaluate the pros and cons of home versus hospital births to make the best choice for your situation. During pregnancy, a common concern is whether to opt for medical intervention during birth. When considering pain medication, such as an epidural, it's crucial to understand the potential complications. While it's not harmful for the baby, it can lead to difficulty moving and affect the baby's positioning. Alternatively, Pitocin can be useful in reducing postpartum hemorrhage risks, a common delivery complication. The important thing is to weigh the benefits and drawbacks of any medication before making a decision. Developing a birth plan is essential to ensure your intentions are discussed with your healthcare provider. Restrictions such as eating and drinking in the delivery room, for example, should be considered and talked about with your doctor. Furthermore, outline procedures that you aim to avoid, like episiotomies. Once a standard practice, it has now been shown to cause potential harm. Consider enlisting the support of a doula, a childbirth specialist who advocates for the mother. Research has shown that doulas have a positive impact on birth outcomes, minimizing the likelihood of C-sections and epidural use while reducing labor duration. Lastly, ponder the option of a home birth. Some advantages include avoiding the need to rush to the hospital and being able to decline unnecessary interventions. Recovery at home is generally easier as well. However, keep in mind that there's a slight risk of complications requiring a hospital trip. Ensure that you've done thorough research before deciding on your birthing environment. In conclusion, make informed decisions based on research and personal preferences. With these choices made, you can focus on enjoying your pregnancy and preparing for life with your baby.
Expecting Better is your guide to breaking free from the rigid norms and misinformation that dominate pregnancy topics. Emily Oster helps you challenge conventional wisdom by analyzing numerous aspects of pregnancy and the evidence, supporting various recommendations. By understanding the data and assessing the costs and benefits of various decisions throughout pregnancy, you can live a more informed and empowered maternal journey. So go ahead and confidently make choices that not only support your needs but also your baby's optimal growth and development, well equipped with the knowledge gained from Oster's findings.